Welcome to our webinar, a Tuesday night webinar with Nikki again, Ask an Expert with Nikki. Tonight, we're going to talk about mental health assessments and supports. Last week, if you were with us, you know that Nikki spent some time talking about IDEA and mental health. And we want to, first of all, thank you for the feedback you gave us. Nikki and I took a look at that. And so she'll be sharing some of you had some questions or ideas, and so that'll be discussed or part of her conversation tonight. So she's also including her presentation so that you all have access to it. It's in the chat. Again, if you have questions, please put them in the chat or the question and answer, and we'll try to capture those at the end. As we're moving forward, just want a couple of things I want to make you aware of. That you will get a feedback form. Please fill that out. We met last Friday and we went through it and we looked at every question and looked at comments and really took those to heart and wanted to make sure that we take that feedback in a way that's going to help move this work forward. The other thing is that as these are completed, they will be put on the Ask website on the YouTube under our information. And so I'll also make sure that her PowerPoints are attached either by link or a PDF. And then the last thing I just want to share real quick is if you get into our website and you go to events, usually it's a state conference that is held in person. Of course, with COVID, we can't do that. And so this year we're going to hold 4 sessions over the 4 Saturdays in May, starting on the 1st. From 10:30 to noon, and we have some dynamite speakers. We have information about Chapter 103. We have information from Laderick around advocacy and a young man that just struggled in high school and didn't even know he couldn't read till he got to college. So he has a really good story to tell. We also have Dr. Warren, who's going to share some ways to just think about how to unpack and think about our thinking about taking care of ourselves. So please get on there and take a look. If you want to sign up for all 4, great. If you only want 1, that's great too. Also, the first 200 that sign up, you're going to get a little gift box. So we're collecting things people always love. Who doesn't love the free stuff when you go to a resource fair? And so because we can't be in person, we're asking those partners to share their materials and we're going to ship it out to folks. And there's also some things for the kids. So please get on the website. Together We Can Conference. It's in May. So that being all said, I want to turn it over to Nikki and move it forward tonight so she can share around mental health assessments and supports. Again, at the end, she and I will take questions and we will try to answer those and share with everybody. So if you have questions, put them in either the chat or the question and answer. So Nikki, I'm going to turn it over to you.
All right, sounds good. I'm going to share my screen here real quick. Thanks for all coming back again to listen to my presentation. And tonight we're going to talk about school-based mental health supports. We'll talk about assessment a little bit too. Mostly I'm going to really talk about some of the questions that came up last week about who does this work and how can we get all of this stuff done given our limited resources and things like that. So quickly, just a little housekeeping. Again, thank you to those of you who attended last week. Really appreciate you all being here and giving us that feedback like Deb said. I did post a link to the slides in the chat and I posted it a couple times, so hopefully you guys see that now. Deb, if there's a question or something like that they are not getting to see that or something's happening, please let me know and I will try to fix it. What's coming next? So I just wanted to let you guys know what's happening with Sue and that she will be presenting on a couple different things in the next coming weeks. Next week will be presentations on writing IEPs for students with mental health disabilities. And then her second one will be around case law surrounding BIPs. So that's what she's going to be working on. And then I just want to let you guys know, reach out anytime. My email is right there. If you have questions or just want to talk through something, if you want to have a discussion because you're not in total agreement with me, that's cool. Let's have that discussion. I'm always willing to have great discussions with people. I know that is not easy work and it can be difficult, and the law is a little wishy-washy from time to time, and so we definitely want to have those conversations. I want to do a quick review from last week just in case anybody is here tonight that wasn't here last week. So I'm going to go hit 4 big points that I talked about last week. The first is we talked about the definitions of emotional disturbance and other health impairment that are in the IDEA law. And they are related to Iowa's domains of behavior and adaptive behavior. So we talked about how the current federal definitions aren't really clear. There's some controversy around those definitions and they need revision. So if there's going to be a reauthorization of the IDEA soon, we should hopefully have good conversations around revising those definitions. The second big point was that IEP teams determine services based on evaluation. That's not a new point to many of you, but we were talking about mental health services specifically. So we talked about how FBA and mental health assessment together are considered by IEP teams to determine services for students with mental health disabilities. So we don't want to just do narrow FBA, but we want to consider mental health kinds of things within all of our, evaluation process. And then we talked about related services, which are counseling, social work services, and psychological services, and how those services are available within the IDEA. And those related services are similar to speech therapy, occupational therapy, and physical therapy, and those kinds of related services in the same part of the law. And so those are potential mental health services that could be provided to students by their IEP teams. And then finally, if the IEP team determines that students need related services to access their free and appropriate public education, then the school district must provide them. And that also includes the related services that we're talking about more tonight: counseling, social work services, psychological services. Okay, so moving on to new content. Who then provides these related services? So when the Every Student Succeeds Act came out, a new term was included in that law, and that term is Specialized Instructional Support Personnel, or CISP, because we love our acronyms. And CISPs are referring to school counselors, school psychologists, school social workers, school nurses, and others who support student well-being. And so I have some links here in the slide, and hopefully it all comes up here. Seems like my computer is being a little slow tonight. But the National Alliance of Specialized Instructional Support Personnel was created. And this is a group of national associations that came together to provide information about the CISPs and their roles and what they can do and advocacy around those roles and things like that. So that's one resource to kind of look at, is the CISP website. Then we can also look at, I really like, so you can kind of see this over here is the kind of all the different associations that come together to create the National Association of CISP. And so you can see NASP is in there, National Association of School Psychologists. I have a little bit of a bias towards that one since I'm a school psychologist, but you see American School Counselor Association in there. I believe the School Social Work Association is in there right there, American Psychological Association, and so on. So a lot of the nurses are in there as well. one of the things that sort of came out of this, different states have started to come up with different documents, sort of defining the roles of the different CISPs. And North Carolina came up with one I think is pretty nice. And so the link to that is in there. And so what they did was they took, a few of the CISPs and they added school resource officers as well, and made a document to show what their preparation was, what the licensure was for each of them, alternative routes to licensure, their roles as defined by the National Association of that profession. And then they created this mental health continuum, which we often see in a triangle, but they created along through this kind of linear model. And you see universal supports, supplemental supports, intensive intervention. So that would be our lower part of the triangle, our middle part of the triangle, and our top part of the triangle. And then they made these little spectra down here to show that school counselors are working, up through, the lower end of the intensive intervention. School psychologists are starting at tier 2 and moving through intensive intervention, as are school social workers, and school nurses are more like school counselors and working up until this part. So I thought this was a really nice visual to kind of think about our CISPs and how they work throughout the different tiers of a multi-tiered system of support. Okay. But I'm also going to show you not just talk about CISPs, but talk about systems to support school-based mental health services, because all of these different professionals, these mental health providers, work within larger systems. And we know that when we have really efficient and effective systems for providing school-based mental health, more kids get what they need. And so we really want to have those systems in place. So I'm going to show you 3 different models that are sort of out there for school-based mental health services. And the first one is the Interconnected Systems Framework. And really kind of the other 2 that I'm going to show you are similarly MTSS systems, which Interconnected Systems Framework is also an MTSS, our multi-tiered system of support. ISF is a combination of PBIS and expanded school mental health models. So back, I think I said this last week, but back in the early 90s, the federal government provided grant funding for 2 centers for school mental health. One was on the East Coast, one was on the West Coast. And on the East Coast in Baltimore, they started working on expanded school mental health models, where they brought in community-based providers, psychologists, social workers, mental health counselors, and brought them into the schools. So a community and school partnership was formed, and that's when they called that expanded school mental health. And the expanded school mental health people, the researchers and the people who are really working on that, Mark Wiest is one of them. They got together with the PBIS people and said, hey, it seems as though our 2 systems can work in conjunction with one another. We are both really talking about multi-tiered systems of support. We really want to bring that universal support into our expanded school mental health. And so we should get together. And so that's what they did. And there's a link right here for Midwest PBIS, and Midwest PBIS will support Iowa schools. And so there's a ton of resources in there. And you can see, I mean, it's a pretty basic PBIS triangle that we've seen a ton of times. Some of the added things that happen within an interconnected systems framework, really the focus is training our community-based providers to work in schools and training school people to work with those community providers, so that together they are all serving on problem-solving teams. They are all working together to support students. And so the mental health provider would come in and provide the intensive direct mental health services. while the school-based people are doing more tier 1, tier 2, maybe some tier 3 kind of things. And they put a big emphasis also on involving families and students in some of their work and making sure that family voice, community voice, student voice, all the stakeholders have voice in how the system is created, developed, and then maintained over time. There are schools in Iowa doing ISF. This is a picture of Grant Wood AEA. This is from one of their pamphlets that they have online. And you can see these little green dots right here. It's this color of green dot. It says down here, Interconnected Systems Framework. So you can see the schools that are working through this pilot project. So Midwest PBIS people are coming up to train people in Grant Wood and working with these districts. Anamosa has been doing it for a couple of years now. You see Midland, Marion, Linn-Mar, Cedar Rapids, College Community, and Vinton are all working on this pilot project through Grant Wood. And so I'm not sure if there are other schools in the state of Iowa who are working with Midwest PBIS to really learn about ISF and go through their training modules and all of those things, but there might be. I have talked with the people who are doing this in Grant Wood, and they are working with different community providers and really bringing that community school partnership together. Now I'm going to show you the Boston Public Schools model. I came across this model in some of my reading, and I really like this model. It's the lighthouse model. We're school psychs and we love shapes. Shapes are like our favorite. And so this has all kinds of shapes, not just triangles. And so that's cool. But also I really like a couple of other pieces of this that I don't see in some of the other models. And one of the things I've been really trying to wrap my head around and understand within school-based mental health systems is the intensity of need matched to the intensity of the resource. So we learned that from, school psychs learned that from Dave Tilley in an article he wrote for Best Practices in School Psychology. And matching, it's called the Heartland Problem Solving Model. I call it the Drunken Snowman model because in grad school, that's what my professors called it. So that's what I call it and tell my students that's what it is. But Dave Tilley talked about students exist on a spectrum, right? And that we need to match resource to student need. And so I always had that in my head and wasn't sure how that was exactly shown in our triangle in terms of provider expertise. And so we see here in the lighthouse model, we have this arrow here on the side that says intensity and provider expertise. And you see it's kind of going in up and down way. And basically that, provider expertise, different provider expertise is needed at tier 1 than it is needed at tier 3. And so if we have tier 3 intensive needs, we need people with some pretty experienced and high expertise in mental health to provide services for those students. So I really like that part of this. I like how they have the screening and progress monitoring piece in here saying twice a year, universal screening, monthly for tier 2 up into weekly and maybe, even daily for some of our kiddos who are in special education. They have the essential components on the bottom and then these partnerships, right? Which is kind of what we were talking about with ISF. There are these partnerships with mental health providers, with university people, with community people, with hospitals to really provide this whole wraparound of services for students. So I really like this model. I think we can learn a lot from what Boston is doing. Clearly, that's a big city. We don't have maybe all of these resources in some places in Iowa, especially rural Iowa. There are things we can learn from this model as well. And then finally, I'm going to show you a model that I have been working on for 4 years with North Mahaska Community Schools and Great Prairie AEA. We have a partnership with them. So we got a grant together and we have been working on this. This is our 4th year. We'll get 1 more year to work on this with grant funding, and maybe we'll be able to continue the work after that. We'll see what happens. But we have been working on this for for quite some time. Systems change takes a long time, and we're getting better each year. So this is our model. We have a triangle, and the partnerships between North Mahaska, Great Prairie, we have community providers sort of involved peripherally. If our students are already seeing a therapist outside of the school, then we might make connections with that therapist to make sure that we're wrapping around, we're supporting that student in school using skills that, encouraging the use of skills that maybe that outside therapist is teaching. So what has sort of happened is that Great Prairie hired social workers so that districts could buy time to provide mental health services. This is direct mental health services, but also indirect mental health services. So supporting the teams, being part of the problem-solving team, really using that interconnected systems framework model, but not necessarily a partnership between a community provider and the school district. Rather, we are partnering across our AEA and the school district. And one way we're able to do a lot of what we're doing is through the grant, but also through operational sharing. When social workers became part of the operational sharing law, then now we can share a social worker across the AEA and the LEA, or North Mahaska, and the school is able to get some extra funds because of that sharing. So that has been helpful in order to fund some of the things that we're doing. So you can see in the triangle piece over here what our school counselors are doing. We have an at-risk teacher at the secondary building, and then we have AEA school social workers who work with both gen ed students and our special ed students. And then we have community providers, again, who, if our students are already seeing somebody, we're not going to ask them to switch. They will continue to see that person, and we will just communicate with them. So this is how we've been working our system. Again, it's a small rural district in Southeast Iowa, and there weren't very many community mental health providers, so we were using the AEA instead, and this has been working out pretty well. And Great Prairie has been able to offer this up as an expansion to other districts as well. And they continue to work on how this works, what this looks like, training people and all of those kind of things, because we want to make sure that we're collecting good data, we're making progress, we're helping kids, and we're doing all of those kinds of things. So it takes some time to take these systems and bringing them into schools and get everybody sort of, doing the things that we want them to do that are good for kids, quality, evidence-based interventions, quality progress monitoring and data collection, really good teaming, and making sure that we're bringing data to make decisions in our teaming. So there's lots of things that we've had to work on over the years. And like I said, we still have some ways to go, but we're getting better each year. Okay, but I didn't want to also forget about our special ed teachers. So we're still under that, who's doing this? So who does the related services? Mental health providers do, but we also have, remember this little pie chart that we saw last week, and special ed teachers provide the specially designed instruction piece. So the related service providers, school psychologists, school social workers, counselors, will provide the related services, but teachers provide the SDI. Okay. So what could that look like if teachers are providing SDI and mental health providers are providing related services? Of course, special ed teachers have some expertise in behavior and know some things about mental health and those kind of things. So how do we work together to make sure that our students are getting what they need to succeed? So I have a couple of these examples to illustrate. And I love examples, and examples scare me at the same time, because I don't want you guys to think that this is the only way this looks. These are just examples. I could come up with any number of examples, and I'm sure you guys can come up with some examples as well. So I'll just share a couple examples. So this example is a 15-year-old student with severe anxiety. skipping classes due to panic attacks, not coming to school many days, attendance issues, eligible for an IEP, and the IEP team uses the evaluation data to determine that this student needs counseling as a related service to access her FAPE. And she's also getting SDI and classroom accommodations and all the other good things that we put on IEPs as services. But I wanted to focus in on the related service and the specially designed instruction. So in this case, the mental health provider might meet with the student once a week to work on anxiety. And also that mental health provider might do some indirect services, working with the special ed teacher on how that teacher can support the student in the classroom, remind her of her skills, help her through panic attacks. And so those minutes, those collaboration minutes might be a related service. And then also the special ed teacher is going to provide SDI minutes each week to support that academic work, remind the student of their skills, and provide maybe a less anxiety provoking environment for getting work done and doing those school-based, kinds of instructional pieces. So together, the special education teacher and the related service provider are able to support the student. Another example is an 11-year-old student with academic disabilities who struggles with classroom behavior. Evaluation data suggests that the behavior is likely due to the student's academic struggles. When the work is less difficult and demands are reduced, the behavior is improved. So we might have a hypothesized escape function with some of the behavior things. The student qualified for special ed under the academic and behavior domains. So in this case, perhaps the special ed teacher provides SDI for academics and also provides SDI for behavior, working with the student to learn how to take breaks, ask for help when work is difficult. And then the teacher might collaborate with a mental health provider if and when the behaviors are not improving, or if other things arise that we didn't find within evaluation. So that mental health provider, in this case, is taking a much more indirect role, but is there if consultation is necessary. Okay, those are the examples. And that's pretty much sort of everything I have to present tonight. I really left a lot of time for questions and discussion because I know that there are big issues out there. There's a funding issue, there's a shortage of mental health providers issue. There are a ton of issues that and obstacles that keep us from, doing these kinds of models and doing this kind of work, yesterday. I know that we have huge obstacles. We also have a capacity issue, even within our mental health providers. Some of our community-based mental health providers aren't comfortable working in schools, don't know how to collaborate with educators, don't know special education. And then we have education people, school psychologists, school social workers, teachers who feel, I'm not sure I know enough about mental health to provide some of these kinds of things. So we have a long way to go. But we have some really great models out there that we can start with, looking at, learning about. And, this stuff doesn't get done without great collaboration. And so I am interested to hear your questions, your ideas. If you want to know more about our grant program, I don't know if Angelisa is on tonight, but if she wants to say a few words about our grant program and what we've been doing in North Mahaska, that'd be great. So I'm going to leave the rest of the time open up for discussion, except before I do that, I'm going to say a couple of things about just kind of summing up, and then I'm going to talk about my research project again. For those of you who weren't there last week, I'm going to do one more plug for that. So a couple other considerations, training of the provider, that's a big one. The special ed teachers, related service providers, if they are uncomfortable providing some of the things that a student needs, we need to figure that out. Who is the best person to do this? Do they need extra training? Do we have somebody else who has, that expertise? And then second, what is the intensity of the need of the student? If we have high intensity of need, we need more expertise. If we have lower intensity of need, we could probably, have less intense of expertise. And so For example, a special education teacher may be able to take on a less intense mental health need, but for more intense needs, a mental health provider is necessary. I think about, some really severe anxiety, depression that can lead to suicidal behavior. How do we do that? How do we help that student? And I might need a mental health provider to do that. I think about my own practice, and there are things that I'm not trained to do. I've had students have psychotic episodes, and I am like, nope, that is way out of my wheelhouse, and I need to refer to somebody else who has that expertise. So I'm not a grief counselor either, and that is something I've never been really trained on or good at. And so if I can do crisis, but if it's long-term grief counseling, that's definitely not in my wheelhouse, and I would want to refer a student to those kind of services as well. So we all have, the things that we don't know well and the things we do know well. And so we need to continue to work within those boundaries, and we need to have those conversations, right? Number 3, communication, collaboration, and teaming are vital to success. We need lots of different brains with lots of different levels of expertise working together to make this all work. All right, and my current research, just to remind you guys and to invite you to participate. So parents of students who have adaptive behavior goals to participate in a study. I'm investigating how mental health services are written into IEPs and behavior plans. And I would like to look at actual IEPs to do this work rather than just do only self-report from practitioners and families. And so if you are willing to share your student's IEP and behavior plan with me, you can click on that link right there, and that will take you to a consent form and more details on the project and what participation looks like. But it basically is just sharing your student's IEP with me, identify all of this stuff, and it's just anonymous. None of your child's information is shared with anybody. So if you have questions about that, please contact me and we will open it up for discussion.
Okay, well, Nikki, we do have a couple of things. I do want to circle back on something that you said at the very beginning, and I know we touched on this when you and I looked at the information last Friday, because this is work that, it's newer than, it's an area that we're all growing in, learning to lean into. And so you mentioned, reach out to you. I am Angelisa, I see you're on. I am going to open it up so that you can share. I am curious about the grant. And so I'm sure other people are also. And so I just think, we have experts right here in our own state. Let's collaborate. And so I would encourage you to reach out to Nikki or other partners on here. That's how we learn and we get smarter from each other, and just, how can we grow this learning and understanding the bumps along the way, so that the next, somebody has to go first, and then we get better at it because somebody went before us. So just Northwest AEA mentioned that they have started working with Midwest PBIS this year on ISF. So that's awesome. Question from Kara: where's the line of outside collaboration, identified need for IEP, but district AEA staff isn't equipped and parents aren't paying for outside services? Do you want me to read that one to you again? There's a couple of questions in there.
I think I get it, but yeah, go ahead, read it again.
All right. And Angelisa, I'm going to open it up so that you can chat also. Where's the line of outside collaboration, identified need for IEP, but district AEA staff isn't equipped and parents aren't paying for outside services?
Right. So I'm going to kind of interpret that a little bit because it's not completely clear to what the question is. But so when it comes down to, like, parents aren't paying for outside services, we feel that the kid needs services. The AEA people that are working in the school are feeling like we're not, this is outside of our boundaries, right? And how do we find those services? And I think this is one of our biggest hurdles, right? Especially in rural areas, but definitely in the cities too. I just talked to a person recently who was asking about mental health services, and there is a 2-month wait 2-month wait in the Iowa City area to get in to see anyone. And some practitioners are just saying, no, we don't have any spots, so I can't help you. We're not even doing a wait list anymore. So I know this is an issue, and one that doesn't have an easy answer, right? We need more mental health providers across the spectrum, from school psychs and school social workers on through to clinical social workers, mental health counselors, school counselors, psychiatrists, and the whole spectrum. And so I don't know that there's this great, real, easy answer to that issue. I think, as a team, it goes back to collaboration, consultation, and teaming. And we've got to figure out a way to help these students who need services to make progress, to access their education. We've got to figure out a way to find them. And that is not always easy. And so I wish there was an easier answer to that, but we just got to do a good job at creatively collaborating with as many people as we can to find those services for kids.
Yeah, and Kara added, and I'm even wondering if they're paying for outside services, school paying versus parents. So all really good questions.
Yep. And it's different for different cases, right? I've had kids who their parents pay for outside services, and then we wrap around and our people at school are calling that outside provider and speaking with them and trying to support the kid at school, while also communicating with outside providers. So any and all of those possibilities with teaming, collaboration, and consultation are possible.
So we've got 3 really good questions, but I know, Angelisa, thanks for hopping on. And so I'm sure people are very curious and would like to hear about the grant and hear a little bit more around what that work is and how that's happening. And I would like to get to these questions for folks tonight too. So we're at 7:10, so that's awesome. We've got a good amount of time left. So Angelisa, did I open it up for you?
Yeah, can you hear me, Deb?
Yeah. Thanks for hopping on. Okay, super. And yeah, I'm putting you on the spot, but I knew you wouldn't care.
I warned her that I was going to say her name. So
it helps to be among my friends. So Angelisa, if you wouldn't mind kind of speaking to what Nikki talked about, and I'm curious too about that grant, because it seems like it's covering a wide range of schools.
So the grant specifically is for North Mahaska, but what we learned, Deb, from the grant experience is that with the ability to use sharing dollars to purchase social work services, we were able to expand that original grant work and offer it to other districts in our AEA who wanted to use their sharing dollars or some of their at-risk money to purchase social worker time. So I'm going to say around 10 different districts that we work with. That's off the top of my head. So it's about slightly under a third of our districts who have contracted for some sort of social work service. And we've laid out an MOU and some agreements. So we talk about, including the screening process, working as a team, using data to make decisions. And then I've really left it up to the districts to decide what I'm going to say is kind of what tier of support and how they're going to use those contracted social workers. So I know we have some districts where they're using those people primarily to provide more tier 2 type interventions, do groups and work with groups of kids and see more students. And then we have some districts where they've really built a bigger continuum, somewhat similar to North Mahaska, where we're one piece of the puzzle, but they've also brought in community mental health providers. They're using their guidance, they're using at risk. So they've really looked at how they've built their continuum across to serve multiple students' needs.
So of course, you can reach out to you or Nikki if people would like to gather some more information, and that, that's what we do. We learn from each other and then try to replicate or improve on so that we can continue to move this work forward for kids and families. That's great. stay on, Angelisa, because there's questions here and it's probably between you and Nikki, you'll be able to answer them. So this is from Jennifer, and it says, much of Iowa lacks any community services for schools to partner with. In many of these areas, the school psychologists and social workers are already stretched too thin and leaving the AEAs in droves. How can capacity to do this work be expanded in these areas?
Awesome question. One that I spend lots of my time thinking about, and also my service time advocating for at the legislature, because we're public education. And, you know, the more funds that get taken out of public education or not put into public education is one of the reasons why all of those things that you mentioned are happening, why, you know, caseloads are up and school psychs and school social workers are strapped, and there's no mental health providers in rural areas. That's just not an education problem. That's also where we're not, you know, funding those systems that move mental health providers into rural areas and things like that. So one of the things that we have done at UNI with our school psych program is we have partnered with Green Hills AEA and Prairie Lakes AEA to create a grow your own school psych program. So we have a federal grant that supports that program. We are just starting our second year on that program. We have a cohort of 4 students. Some of them are on this call right now. I saw Linda was on. And they are people who live in Western Iowa, work in Western Iowa in education, and have decided to come back to graduate school to get their EDS in school psychology, to be a school psychologist in their AEAs, their respective AEAs. And so that's one of the things we are doing. There needs to be much, much more work in this area, because I don't think that we really tackle, you know, that bit, you know, as a sentence of like what, 12 words, but has huge, heavy lift to answer that, because we just need more people, and more funds is how we get more people and different kinds of programs and creative programs to get people to move out into those rural areas and serve kids and adults all across the spectrum in those areas.
For sure. This is from Christina. Do you have a suggestion of a provider to do mental health assessment for an individual with ID? The FBA has been done, but we are missing the mental health assessment, the MHA is what she said. I believe we need to do a plan to help support this individual with both in order for him to be more successful. So I don't know if that's somebody that should just reach out to you and you can work with them.
I have lots of questions, right? I have questions.
Yeah.
It might be a more one-on-one answer, you know, I mean, because the general answer is within this whole entire presentation, right? There's lots of different people who could do that, but I don't know who you have access to and all of that kind of stuff. So it, you know, as the answer often comes up, it depends. And so, you know, reach out to me, send me an email, and we can have a conversation over email or do a Zoom call or something like that. And I can maybe direct you in the right way. I may not have the exact answer, but I can give you some ideas on some questions to ask and things like that.
Great. This is Alicia, and she's our family support person from ASK. So she works directly with families every day. What can parents do to advocate to get mental health services in their child's IEP? For example, a child needing a higher level of support, tier 3 with certified mental health counselor, but the resident district doesn't have such providers collaborating in the district. And I guess I'm going to send this to you and Angelisa. So how do you guys make that work? I mean, you know, so how does that, the way you're working with those districts, help get to kids that have the highest need?
Right, Angelisa, I don't know if you want to respond to that. You know, the special education IEP stuff is things we've been talking about, you know, on at several levels of our grant program, and still haven't, you know, totally nailed that down, but you're thinking about it a lot, I know.
Yeah, I mean, I can say, I think you're right, Nikki, that that is still a gray area for us, even all these years into the program, and trying to figure out when it gets put on an IEP, what gets put on an IEP, and what that looks like, how it reads in the IEP. And so I think for me, it comes back to, you've got to have the conversations as an IEP team. So what data are we looking at as a team, or what data do we need to get as a team to help make those decisions, and have those conversations around what is FAPE, what is really included in that child or that student's free and appropriate public education. And I've had numerous conversations with my social workers. Like, there's no easy answer to that, because it's not like I can say, oh, here are the 10 criteria, and if you check 5 of the 10, you get it on your IEP. It just doesn't work that way. So it's more, continuing to engage in the conversations and ask the questions, I think.
Yeah.
So-
and then also who, right? How do we, the way we do that, within North Mahaska is, we have 2 social workers. We are, yes, luxury, right? We have 2 social workers who are in our district, 3 days a week, I think, across the 2 of them.
Yep. And
they're providing one-on-one services for kids who have IEPs, for kids who don't have IEPs. And we have luxury because we have been working on this for 4 years, because we have grant money that started this, because Great Prairie AEA has, really used those operational sharing dollars to the greatest extent, right? So like all of these things that we have learned over these last 4 years. And when you're in a rural area and you don't have those easy access to mental health providers, it becomes difficult, and there's not an easy answer to that. But I agree with Angelisa that, the IEP team members need to be looking at data, like I talked about last week, need to be having those conversations and figuring out what we can do, what we can access in the community, what we can access through the AEA, what we can access within our own school building with our school counselors and our at-risk professionals and things like that. So sometimes there's going to be some hard decisions.
So Shelby, and this is going to go because Angelisa, I got a question for you around all of that. So she wrote, whoops, I just lost it. Sorry. What are the questions the IE team asks, and what is the data the IE team takes into consideration, and what is FAPE in regards to their mental health medical diagnosis? So what would a family member, like, how do they advocate, or because they're part of the IEP team. So, how, and I don't want to get stuck here because we have other questions. This just tells me we have to have more of these. You guys are awesome to share this, but what do family members, what can they bring to the table? Because they're the integral part. I mean, we wouldn't be there if it weren't for the family. So how do we look at that? Angelisa?
Well, I think that, for me, like, if I, as a parent, have a child, and let's say I have a diagnosis of a mental health concern, or, I've been seeing my child being really anxious at home, like, I think you need to come to the team and say, like, one, if you have a diagnosis, you need to bring that to the team and share that, and share whatever recommendations have come with that from a medical provider or an outside provider. But I think you've got to be really honest and open and talk about, like, here's what I'm seeing at home. Here are the things I hear about, like in my example, my child's anxiety around school and what they're saying is causing it. What can we do to make it better? What can we do to address those needs that, isn't just, maybe what's already on the IEP, or it's not as kind of the traditional behavior plan that we think about around more of those problem behaviors. So that's kind of how I would approach it, is bring that information, because you are the expert on your child, and you know what they're telling you at home and what you're seeing at home. And,
so
we need to work together.
So it's really that relationship, and then encouraging the family member to share that is what I hear you saying. So, because this is a pretty frequent question that we get from families around their kiddo and how do they advocate for it. So we could probably do a session on that. So don't be surprised if I circle back, because that is a concern. And they, it's like, so what do I say? What do I do? So anyways, I want to keep us moving. So we've got a couple more questions here. And these two kind of go together. How do you support special education students who struggle with mental health and are attending school virtually? And then could telehealth be an option for those kids in districts that don't have mental health counselors present in schools? So kind of similar, not really. And then we have two other ones I wanted to get to.
Yes, I'm so glad that you asked the telehealth question. This is not always at the top of my mind. I've been skeptical of telehealth, but I'm coming around because the data is starting to come around as well. And one of the and I think, yes, telehealth is a possibility, like something is better than nothing. And if we are getting better data on telehealth, I'll feel even better about it. I work with Blackhawk Grundy mental health people around the Waterloo area and some other mental health providers, community-based mental health providers, and they have seen kids do pretty well with telehealth. And I'm like, okay, I trust them, but I want to see more data. But I think it is something that we need to look at in our rural areas. So one of the things that's happening in Green Hills AEA is that a couple of our students who are in our grant cohort are going to be doing some telehealth service providing as part of their internship. And so that's kind of an exciting little piece that we're doing as part of our grant, is providing some telehealth services through the AEA so that we can get out to some of those rural areas. So I think that is something we need to continue to talk about. The legislature has done some things where they have said that telehealth needs to be covered on insurance and some of those kinds of things. And so we're starting to see more and more of that. And I think pandemic has taught us some things about telehealth, and we need to keep learning.
Yeah, totally. And I think it's just going to keep growing because we know that we need to get to all. Angelisa, this is for you. Do the regional directors at AEAs like Great Prairie share with other AEAs about what they've done to access these critical services? It takes creativity for sure. I think I know the answer, but maybe you can speak to that. Again, how are you guys moving this forward? Because you're separate, but you're all equal, right? You're one big system to help the state. So maybe you can touch on that.
Yeah, Deb, I wouldn't say it's the regional. Yeah, I would. Can you hear me, Deb?
Yep.
Okay. All right. I was just going to say, I wouldn't say it's the regional directors as much as at the state level, the AEA special education directors meet regularly, and we also have some state groups. So I know I've shared, and we've all shared. I know we like to share the information that we're learning and resources and that sort of thing. So there are various state groups that I've talked about the model we're using, but I know Grantwood and Northwest, they've done the same. And so there is a mechanism for us to share that information, and I'd be happy to talk to anyone about it who's interested too.
Great. So just reach out to you. Great. Kara
yes,
asked,
yep, you've got my email if you want to include it.
Yep, perfect. Kara has asked, has the non-categorical, the only state in the country that does it this way, piece contributed to the smaller number of school psychs across the state, or does this continue to be a roadblock?
This is across the nation. The school psych issue is a shortage across the whole entire nation, except for New York for some reason. But the data are clear. There's a nationwide shortage of school psychologists. So if anybody out there needs a second career, maybe you want to look at school psychology because you'll be able to get a job. Or, encourage your nieces, nephews, grandchildren, children, anyone who is half interested in education and psychology. I can call me up. I do our song and dance about school psychology because we need you. And yeah, it's a nationwide shortage. And the data that we've been looking at for school counselors is similar. Shortage across the nation for school counselors. I don't know about school social workers as much.
So we're down to just a couple minutes. We have one question left. And so when a child is receiving private therapy, could it be written into the IEP that the educators collaborate for X number of minutes per week or month? I know this happens on occasion, but I don't believe it's a common practice. Maybe Alicia, or I mean, Angelisa, you would like to take this one because you probably are more, to me, this is operationalizing at the school level.
Yeah, I think there are a couple different ways, Deb, that could be written into the IEP. So it's probably more likely that it would be written as a community linkage so that you're linking with that community provider. And, I'd be hesitant to write it into the IEP as X number of minutes without having that community mental health provider at the IEP meeting to make sure that that's something that they can also agree to and participate in. But I think you've got some options to reflect the use of a community provider and outside provider within the IEP.
Great. You guys have been great tonight. I do want to end on the positive at the end. Alicia shared, she's at Ask, and she's used telehealth for her daughter, and she said it's been awesome. So I think that's a really positive, again, another testimonial from a family member, that it's helping her daughter and helping time for the family and all those things. So thanks, Alicia, for sharing that. I want to thank all of you for coming tonight. Please fill out the feedback survey. Nikki and I will take a look at those. Angelisa, thank you for coming on. I see us maybe circling back and doing this again in the fall and answering some questions for folks. I think this has been a great opportunity. And so hopefully you all walked away with getting a little bit smarter. If any of you know me, I like to get you thinking about your thinking. So hopefully that did tonight. And I just want to thank everybody for joining us through Ask Resource Center. So again, thank you and have a good rest of your evening.
Thanks, everyone. And thanks, Angelisa.
Yeah, thanks, Angelisa.